Hello everybody. So this video is on IHC marker CD45, also known as LCA, that is your leukocyte common antigen. So CD45, also known as leukocyte common antigen, is a pan-hematopoietic marker. It is one of the most common screening markers used for metastatic tumors and for poorly differentiated tumors. It is used to identify the lymphoid or the hematopoietic origin of tumors, and hence it helps us differentiate between lymphoma or leukemia versus your carcinoma or sarcoma. It is the first line IHC marker for your undifferentiated or your small round cell tumor markers. Normally, you can see that it is expressed on your B and T lymphocytes, NK cells, monocytes, macrophages, and granulocytes, and hence it's also positive in tumors arising from these cells. It is not present on epithelial, mesenchymal, or neural cells, and hence it can differentiate your hematopoietic cells from other cells. It is used to highlight even immune cell infiltrates in inflammatory lesions, where sometimes they can be mistaken for malignancy. Staining pattern is membranous and cytoplasmic. So positive, as it's positive in lymphocytes, it is positive in the tumors of lymphocytes, that is lymphomas, leukemias, histiocyte-rich disorders. Any tumor that is hematopoietic in origin will be positive for your LCA or CD45. Where is it used? It is mainly used to exclude carcinoma sarcoma or to confirm your diagnosis of hematopoietic lineage. It is very sensitive and specific for leukocyte origin. After this, you can use a further selection of markers for further subtyping. In inflammatory conditions, it mainly helps us identify these inflammatory cells. Limitation, like all your IHC markers, sometimes you can get weak positivity in non-hematolymphoid tumors, and sometimes the strong positivity for CD45 or LCA may make us mistake an inflammatory lesion as a lymphoma, and hence you must not use it alone, but you must always use it with a panel. Practically, when do we use? It is used when you're suspecting a lesion to be a lymphoma or leukemia or any tumor of hematopoietic origin reported as positive or negative, and always, like all IHC markers, you have to correlate it with your clinical data, radiological data, and morphology. Identify the animal and let me know in the comments. Thank you.